dedicated to Femtech especially. And thank you to the organizers for inviting me, thank you to my fellow panelists. Regarding the question, I would look at all of that from the point of view of evidence, right? Because evidence of effectiveness, evidence that a particular digital health product is indeed making a difference. Now, this is something that we obviously are taking very seriously, not only myself being a representative of academia or being involved in all that research, but we know that eventual adoption of all that technology depends on high-quality evidence. Right? Now, we know that, I know that from my academia experience. I'm sure that our respected founders and entrepreneurs also know it from their business experience. It is unfortunately not that easy to generate high quality, excellent evidence of effectiveness, and especially evidence of clinical effectiveness of any digital health product. Now, that said, should we compromise on quality of digital health products in order to bring more products to the market? Definitely not. Should we try to find innovative ways of generating that evidence, looking for that evidence, and demonstrating that evidence? Definitely yes. And that has been something that we've been working on, and we've been campaigning, we've been advocating for. It's the medical doctors in the room. I'm not sure if there are medical doctors in the room. Please give me a hand if there is a doctor in this room. Okay, never mind. Yes, at least there is one. I mean, we medical people, we know the so-called gold standard of clinical evidence that used to be the so-called randomized controlled trials. How applicable are RCTs in the era of digital health? This is basically an evolving field, and there is a lot of discussion and a lot of conversations and a lot of developments in that regard. With regard to, and of course, we all understand that it is basically next to impossible to develop. It is possible. There are obviously approaches of generating or conducting even randomized trials or controlled trials, including using digital health products. But we all know that it may take significantly long time, it may take a lot of effort, and it may take a lot of investment, a lot of money in order to generate evidence coming from high quality studies, including RCTs, and especially something that we consider on top of the evidence pyramid, which is the systematic reviews of randomized controlled trials, systematic reviews, meta-analysis, and so on and so forth. And that is why the framework of essentially it's not really about regulation. It's about inclusion of digital apps into the armamentarium of mainstream healthcare, and we have such frameworks, and I'm sure my respected co-panelists are going to mention that as well. I'm speaking about DIGA and DIGA Fast Track in Germany. I'm speaking about PECON in France. Later on, I can also comment on that. And that is why the regulators are trying to create the so-called fast tracks. They're trying to support the industry in demonstrating preliminarily the effectiveness of their products, in order for those products to be widely adopted, to be included in the directories of approved health products, and then giving them some time to generate additional evidence.
thank you, Georgie, for highlighting this. And I also like